Most of my questions will be to Holtz Eakin because of his background being CBO. I've worked for 3 years to pass bipartisan bill to lower prescription drug prices. While Democrats attempt to advance their partisan drug pricing program, I hope common sense will prevail and we pass a bipartisan prescription drug bill. I've engaged with colleagues on both sides of the aisle in both the House and Senate. All of the Republicans and Democrats I've contacted have expressed eagerness to find a solution to a meaningful lower prescription drug prices. Mr. Holsekin, for decades, the Congressional Budget Office, the nonpartisan referee, has said government drug price dictation does not save money unless you restrict access to patients through limiting formulary. First, is that correct, Mr. Holsekin?
Yes, that's correct.
Okay. Also to you, is government drug pricing negotiations a real negotiation, or is the government dictating prices?
It's the government dictating prices, and you can't do a real negotiation unless you have a restriction on the formulary or restriction on access in some way, or in this instance, another lever, which is a 95% tax on sales in the U.S. market. So that's not a negotiation. That's dictating the prices.
Okay. I would note that in 2019, this committee held 3 hearings on prescription drug pricing, followed by a markup along with numerous other bipartisan conversations. Given the bipartisan interest in this committee in lowering prescription drug costs and many questions the American people ought to have answered about the package of the majority now considering, I'm very curious if this committee will be holding any hearings on prescription drug pricing in the future. So getting back to you, Mr. Holsekin, President Obama's own OMB director has said this about changes to the non-interference clause. Quote, negotiating ability alone is largely feckless, end of quote. Can you save money if you do not limit access to, like restricting the formulary or dictating prices based on domestic or international reference pricing?
No. Every CBO director since me, when the Medicare Modernization Act passed, has come to the conclusion that there's no additional genuine negotiating leverage that the Secretary of HHS would have. Prescription drug plans have lots of beneficiaries, so they have market shares and they have formularies which they can offer as a way to expand their sales, and that's how you get a lower price. The Secretary of HHS doesn't have any of those things.
Okay. Mr. Holsekin, in your previous testimony, you stated that government drug price dictation would restrict access if you want to achieve savings. Academic research has also confirmed that. Can you expand on how patients will be hurt by the proposed government drug pricing dictation policy?
The spirit of these proposals has always been to look to other countries as the reference price, as a starting point of dictating the prices. And if you look at the experience in those countries, the way prices are lower is the governments say no to many drugs, and they are not available to their citizens. As we know, and the ranking member pointed this out, it's an important point, there isn't a general drug pricing problem. That we have high prices for some specialty drugs on patent, largely oncology drugs. Those are the most innovative, most effective modern treatments, and their arrival on the market in the U.S. is in the first 3 months, by and large. They simply don't arrive, and certainly not in a timely fashion in these other countries. So we'd be saying to our citizens, we don't want you to have the best care. That's what those proposals would produce.
Okay, I think maybe you've just now answered this question, but let me ask it anyway. If we disincentivize the private sector to produce cures, will we give up our status as the world's leading research and development country?
Yes, we are the leading biopharmaceutical innovator on the globe, but that's not a God-given right. It's due to the incentives that are in the system. And if we went ahead with these proposals, there would be less incentive for venture capitalists to fund startups that have generated these advances. Those startups often then sell them to larger pharmaceutical companies. They wouldn't be interested in buying them because there would be no return, and the innovation would dry up. It's a real threat.
Nonpartisan independent analysis showed changes to the non-interference laws hurts innovation and cures. CBO says H.R. 3 would reduce the number of drugs created. One CBO report says 38 fewer drugs this decade and next. Another report from the University of Chicago, we could miss out on 342 fewer drugs in the next 20 years. Should we be pursuing policies that produce less cures?
No. Directionally, everyone agrees there will be fewer cures. The only debate is over how many and how innovative they might be.
Thank you.
Thank you. Senator Cardin.